Hi, I'm Dr. Lennox, and I'm excited to be here to tell you all about the way I look at things. Maybe it's a little different than you're used to. The topic really is how I establish a sequence of care, how I establish the way in which I'm going to treat you for the problem that you brought me. You know, we look upon your symptoms as a calling card. It's that which gets you interested in taking care of your health. It brings you here. And what I do is I listen to you very carefully, and we have you fill out tons of forms, of course, which you can download off the website. And then we have an interview where I talk to you about your health. When did your health start to erode? What's the calling card of your symptom that you're bringing to me today? What is it that motivated you to look for some kind of help? And so, you know, normally when we go to a physician and a certain diagnosis has a certain treatment. There's medications. Even in the vitamin world, there's a fairly set protocol of what do you treat, how do you treat, what vitamins for this, what nutrition for that, what diet for this, what diet for that. And the thing that's distinctly different about how I choose to look at it is that I like to be present with you. I don't like to treat a symptom, and I don't like to treat a syndrome. I don't like to treat the forms that you gave me. I like to work with you because you're the one who's going to be working on your health. And so the exciting part for me is to be present in the present moment with you and find out what your physiology wants to do. So sometimes we might think, well, this is obvious, this is a parasite problem, or this is obvious, this is a digestive problem, or it's a neck problem. And what I want to tell you is that's really true for the bell curve event. You know, the bell curve of grading where 80% falls within a certain range, and then there's that 10% on the edge. It's like, it's like birth control pills. They're 99.9% effective. But, if you're not one of those 99.9, you're 100% pregnant. And so this is the way medication works, and this is often the way treatment works, that there's a certain standardized treatment for certain standardized things. And what's different about the way I choose to look at things is that my real thrill is being present to see what your body needs in this moment. So, we might have a digestive problem. We might have neck pain. We might have shoulder, arm, and hand pain, the classical presentations that would normally come into my office. So what I'm really interested in is what's driving that kind of stuff in your body, because there's a language between the inside of your body and the outside of your body. There's a language between your emotions and your physiology. There's a language between your physiology and your emotions. And there's a language between what you eat and how you feel. So the sequence of care is basically addressing where your body wants to start. A lot of times there might be 5 different systems that need care. You might find that the system is toxic. You might find that the digestive system needs to be worked on, or that the dietary situation is off, or you're dehydrated, or maybe there's an underlying thyroid problem. And from the point of just looking at normal physiology, there's a way in which you can say, yes, this is the sequence that most people need to have. You have to first be able to digest your food, then of course you can go on to the other things. But in fact, sometimes it's very surprising how it works. Sometimes your body wants nutrition for the heart. And by addressing the digestion first, it's kind of an insult to your body. It's like a conversation, Your body looks at me and says, what do you mean you're going to give me digestive support? I very clearly told you that if you give me heart support, I can improve the circulation and the overall system will come up and do better. So my job is to differentiate and enter into sort of a conversation with your body, to listen carefully to what's being told, and to address that with a level of respect that your body goes, finally, someone's listening to me. And let that body take those next steps. So perhaps we might come in and say, okay, today what we really need to do is give you support for your heart and circulation. So I'll establish via muscle testing the kind of nutrition your body needs, and then send you off to do that. And then have you come back and we'll evaluate what your body has to do next. And it may say, yes, that was great. And we may see the whole system come up into sort of a better plateau. And based on that plateau, the body may say, well, okay, thanks. We're doing really better on the heart. Now what I need is I need to be able to digest my food, because it doesn't do to throw food into your stomach if you can't digest it properly. And on another lecture, I'll tell you a little bit more about how I see digestion. So sequence of care is the kind of stuff that makes all the difference in these kind of cases that you may have, where you've been to other doctors, you've been to other practitioners, you've been through the medical routes, you've tried your dietary changes, you've had lab tests, you have adrenal hormones and things looking at, but no one has figured out the proper sequence because no one has dealt with you as you present in this moment and asked your body, how would you like to be treated? What would you like to have to help you move along toward better health so you can better carry this human being on earth? And that's what I have, sequence of care.